Welcome back to everyone. Dr. Naveen here from UPSC Medical. When you analyze the syllabus part of anatomy, within anatomy, the topic was upper limb and lower limb. So from the upper limb and lower limb, they are not asking many topics. It's clearly mentioned that they will be focusing on blood supply of upper limb and lower limb, and also nerve supply, and not the detailed blood and nerve supply. They are focusing on the applied aspects of it. So when I say applied aspects or clinical anatomy aspects, it goes without saying, when you learn about lower limb, lower limb in general, we'll be focusing more on the venous supply of lower limb, because venous supply, if it gets impaired, it leads to varicose veins, which is again part of our general surgery syllabus. Apart from that, one area where arterial supply to the lower limb is very important is to the head of femur. Why? Because in age-old patients, in osteoporotic old age females, fracture of the neck of the femur is a common complication, which in turn leads to avascular necrosis of the hip, which again is a burden on a health care infrastructure because it goes for hip replacement. So nowadays, hip replacement and knee replacement surgeries are increasing, and it puts an additional burden on the health infrastructure. So when I say this, yes, clinically and applied aspect, the arterial supply of the head and neck of femur is important. That's why it has been asked like long back, the question on arterial supply of head and neck of femur. Now you know the reason why we are discussing this topic. Now let's try to get into the details. To understand it in detail, you need to know what is the parts of the femur as an introduction. Femur, also known as thigh bone, is the strongest and longest bone of the body. Okay, as you see, the upper end is rounded. We call it as head, neck. As you can see here, you have a greater trochanter, you have a lesser trochanter, and you have an intertrochanteric line anteriorly, intertrochanteric crest posteriorly. See, the parts of bone, osteology part is not important for our exam point of view, right? What next is shaft, a long shaft. As I said, it's the longest bone of the body. Lower end, we have medial and lateral condyles and epicondyles, right? We're not getting into the details of it. Just a basic introduction that this is how a bone looks. Okay, if you have to draw the bone also, so this is how the head looks. Then you have the neck, then you have the greater trochanter, lesser trochanter, and you have a shaft. Then at the end you have condyles. Okay, just practice this bone. Let's get back to the details of it. Head, as I said, is more than a spear, and it is directed medially, upwards, and slightly forward, and it articulates with the acetabulum part of the hip. Okay, acetabulum part of the hip. Now when you look at the neck is again 3.7 centimeters long. It has upper border, lower border, anterior surface, and also the posterior surface at the back. Now, coming back to the blood supply part, right? Let's look at the blood supply part. As you can see here in the image, first we are talking about the blood supply of the head of the femur. Head of the femur. Now you need to know, for exam point of view, as I said, if there is fracture of neck of femur, that is this area, if it gets fractured, if the neck of the femur is fractured, what happens? The blood supply to the head is lost. Okay, usually whenever there is a fracture, from the opposite side, we do have a good amount of collateral supply to make sure that the bone doesn't get necrosed. But the problem with head of the femur, as you can see here, is this is the head of the femur. Head of the femur has two important blood supplies. One coming from the obturator artery. Okay, obturator artery from above, from the acetabulum. You have ligamentum teres. Ligamentum teres is a ligament which attaches to the fovea, which is present on slightly below the middle point of the head of the femur. You have a fovea, and this fovea has ligamentum teres, which is an attachment, and within this ligamentum teres you have blood supply coming from the obturator artery, and these branches are known as foveal vessels. So foveal vessels, they supply not predominant part, but minute amount of blood is supplied through the foveal vessels, which are branches of the obturator artery, and they enter through the fovea with the help of the ligamentum teres. Right, this is one blood supply to the head of the femur. Coming back to the other main supply, if I ask you what is the main or important blood supply to the head of the femur, it comes from medial circumflex artery. Okay, you have femoral artery which is coming from the femur like this, from above, from the aorta. This femoral artery has a deep and superficial femoral artery. Now I am only concerned about deep because hip is present, the bone, femur bone is present very deep, right? So we have a deep femoral artery, and this deep femoral artery has two branches, one arising medially, other arising laterally. Though medial circumflex artery arises medially, it circles around and it goes laterally to supply the head and neck of the femur. Now as it is going laterally, the main artery, the predominant artery, the one artery that you need to remember from exam point of view is the lateral epiphyseal artery, which is a branch of the medial circumflex femoral artery. This medial circumflex femoral artery also has lot of retinacular arteries, and one of the retinacular artery which is very important is lateral epiphyseal artery. This gives the second most but the most important blood supply to the head of the femur. Now what is the blood supply to the head of the femur? One is foveal vessels and the other is lateral epiphyseal artery, which is a branch of retinacular arteries, and these retinacular arteries are coming from the medial circumflex femoral artery, right? If you remember this much, it's well and good. Now coming back to the same table, as I said, blood supply to the head of the femur is from obturator artery, which is foveal vessels, and femoral artery, which is divided into deep and superficial femoral. Deep femoral gives lateral circumflex and medial circumflex femoral artery. Medial circumflex femoral artery gives retinacular arteries, and these retinacular arteries, they have lateral epiphyseal arteries, which are the main blood supply to the head. Let's say there is a fracture here. What is happening? The reticular artery blood supply is gone. Now the head is solely dependent on the blood coming from the foveal vessels. If at all this is deficient, there will be avascular necrosis of the hip, leading to future osteoarthritis, leading to non-union, leading to the complete hip bone replacement. Right? Got the point. Now coming back to the neck of the femur. As I said, the neck is 3.7 centimeter long. It connects head with the shaft. The neck has two different parts. The neck has one intracapsular part. The other is extracapsular part. The details are not given here, but what is very important for you to remember is, if you have neck of femur as I said has intracapsular and extracapsular parts. Let me draw the image now. So you have head here, you have a neck part, greater trochanter, lesser trochanter, and coming back to the shaft, right? So this neck, the anterior surface is completely intracapsular. But when you go posteriorly, only medial half of the posterior surface is intracapsular, the remaining is extracapsular. So whatever is it is, if it is intracapsular, the intracapsular part is supplied by the retinacular arteries, which are arising from the trochanteric anastomosis. I'll come back to what is trochanteric anastomosis, but your take home is intracapsular part of neck of femur is supplied by the trochanteric anastomosis. There will be retinacular arteries which are coming from it, and when you observe the image, what happens, if this is the neck and if this is the head, these retinacular arteries, they come from the shaft through the neck, they go into the head, and they form deep grooves on the neck like this. On the anterior and posterior surfaces mainly, they form deep groove like structures. So these are the trochanteric anastomosis, that is retinacular arteries. Extracapsular part is supplied by an ascending branch, which is again coming from the medial circumflex femoral artery. So head and neck of the femur, the main supply is the medial circumflex femoral artery. The medial circumflex femoral artery gives an ascending branch which supplies the extracapsular part of the neck. This much is fine, right? Done. Now what is this trochanteric anastomosis? See, in the hip joint you have two anastomosis. One is trochanteric anastomosis, other is cruciate anastomosis. Our topic of discussion is trochanteric anastomosis, and there are four arteries which form anastomosis around the trochanter, greater trochanter. So what is this? One coming from the gluteal, superior gluteal and inferior gluteal artery. The other two are coming from the lateral circumflex and medium circumflex femoral artery. They all together form a trochanteric anastomosis. From these trochanteric anastomosis, you will get those arteries what I am talking about, that is our very own reticular arteries, which actually supplies the intracapsular part of the neck of the femur. So this will conclude our discussion on arterial supply of head and neck of the femur.